Welcome to Let's Talk About It, where we give it to you raw and unfiltered. The podcast show where we speak what's on our minds. Here's your host, Aminah G.
Thank you. Welcome to another episode of Let's Talk About It. I am your host, Aminah G. I want to start today's show off by making a very large statement to the Black and to the Brown communities. And that is, my dear brothers and sisters, we are under attack right now. We are at war right now. And the enemy we are fighting so hard to stay alive against, and that is attacking us, is COVID-19. Many of you who follow me and listen to the Let's Talk About It podcast show has heard me talk about this deadly virus before. Unfortunately, this is not something that we can talk about one time and sweep it under the rug, tuck it away and be done with it. We have to keep talking about it. We have to keep stressing the importance of this deadly COVID-19 disease that we are at war with, that is affecting mainly people of color. It's affecting our children, our babies. We are at war. Yes, my people, we are under attack. And this is why we have to keep stressing the importance of wearing your mask and social distancing 6 feet or more. Not just sometimes, but all of the time. Avoiding big crowd gatherings and beaches and things of that nature. Wearing gloves on your hands when going into the stores and different places where you have to touch things. You have to become basically OCD with washing your hands, something that we all should be doing even before touching your mask. When we have it on our face, it is crucial to fighting this war, this virus. As we know, there is no cure for this deadly disease. So therefore, we should not be taking this disease lightly, as if we are untouchable. This virus has no name. It sees no faces. It has attacked all age limits. It has killed and hospitalized young people, old people, small children, teenagers. It has robbed us and saying goodbye to our family members and friends in their final moment, spending time with them. We must practice safety at all times, no matter what you are hearing or seeing other folks do. This nation is deeply unhappy with the direction that we are going in. Even though we are starting to see numbers go down in some states, just a little, and that is great news, but that does not mean to remove your mask and stop practicing social distancing. It doesn't mean that at all. We must continue to wear our mask. Mask it up. Continue to wash your hands. Sanitize your homes. We must still do these things. We know pandemics have been around for years, and I want to share with the listening audience a number of deaths on a timeline from the years of 160 AD through the centuries, starting with the Black Death bubonic plague that killed over 200 million people, smallpox that killed 56 million people, the Spanish flu that killed about 40 to 50 million people, yellow fever that killed about 100 to 150,000 people in the late 1800s, HIV/AIDS killing 25 to 35 million people from 1981 to present, and now, today, COVID-19 that has killed so many people today, and the death tolls are still rising. But when the President of the United States was asked about the COVID-19 virus, he says that it is very much under control, and he says because of all that him and his administration has done, the risk remains very low.
You may ask about the coronavirus, which is very well under control in our country. We have very few people with it, and the people that have it are, in all cases, I have not heard anything other.
because of all we've done, the risk to the American people remains very low.
You're listening to Let's Talk About It with your host, Aminah G.
We are at 1,000 deaths a day. And if we don't get this deadly virus under control, we could see an additional 80-something thousand deaths by Election Day. The CDC has stated this could be the worst fall ever. But yet, this president still continues to say this virus is under control. What is clear is this pandemic is having a disproportionate impact on African American communities, as well as our seniors and nursing homes. But I do believe progress is possible because we have seen some states and countries that have bent the curve on new cases and are monitoring the outbreak. But I must say globally, we are very far from the goal of having 0 cases. The president needs to stop playing politics and find a solution to get this deadly disease under control. And that goes for Democrats and Republicans. In other news, August 11, 2020, Russia is now claiming to have the first approved COVID-19 vaccine met by skepticism. Putin has taken an extreme risky approach by approving the marketing in his country before he has finished the testing phase necessary for its validation. Putin will be exposing his country to a product that could ultimately prove to be a really dangerous product. And he is even taking a risk by giving false hope to the whole entire world. This releasing of this vaccine by Russia so fast is worrisome. It is reckless and a foolish decision. Yes, we need a vaccine like yesterday. If they roll this vaccine out to the world and get it wrong, it could undermine the entire global enterprise if they get it wrong. Let me just say that I will not be taking the vaccine when it becomes available in the United States of America. And let me be clear, I'm not telling anyone else not to take the vaccine when one does become available in the United States of America. I want to be perfectly clear on that. I'm not telling anyone else not to take it. I'm simply saying I myself will not take the vaccine, period. Whenever there is a new vaccine, the first people to be used as medical buffers for white folks are black folks, African people. I will not be used as a guinea pig or an experiment like the Tuskegee experiment back in the 1920s. Vaccines take years to create. And I know some people might be saying we don't have years. And I get that too. But understand, the discovery and research phase normally to create a vaccine is 2 to 5 years, according to Wellcome Trust. And in total, a vaccine could take up to more than 10 years to create one. So again, I don't want to be used as a guinea pig. To me, the risk of experiment treatment outweighs the benefit. From the very beginning of this crisis, a student of history said he could see how the African American communities would be hit the hardest from a statistical perspective, and we were. We know there are 90 potential COVID-19 vaccines being investigated worldwide. Hopefully, at least one will be successful because California has been the first state to report 600,000 cases of coronavirus, and 5 communities in South Texas has become the leading hotspot in the United States of America. We are under attack, my dear brothers and sisters. There are too many people of color that lack access to even the most basic health care, and others risk losing coverage for themselves and their families if they lose their jobs. The next time there is a pandemic, and trust me, there will be a next time, we cannot allow the same appalling racial disparities to determine who gets to live or die. because too many people of color work as so-called essential workers, home health aides, personal care aides, nursing assistants, grocery store attendants, mass transit workers. These are so-called essential workers, and they are more likely to come in contact with people who are sick with this COVID-19 virus or any other virus. And to throw salt on the wound, these type of jobs are often poorly paid. The novel coronavirus pandemic, known as COVID-19, could not have been more predictable, my people. Over the past 15 years, there has been no shortage of articles and white papers issuing dire warnings that a global pandemic involving a new respiratory disease was only a matter of time. And obviously, this warning was ignored. No one on earth has an immunity to COVID-19 because no one had COVID-19 until 2019. It was initially seen to be a pandemic in China, but the virus spread worldwide. The human race to survive this pandemic has become the primary concern of the world. And if we don't get a handle on this virus soon, and I mean very soon, there will be no one left to die. Every region in the world needs to make progress against this pandemic. And this means getting the numbers down to 0 cases. And it is possible to do that. So how can we make progress against this COVID-19 pandemic? We need data. But data is not enough. This is especially true in this pandemic, because even the best data available to us right now is far from perfect. I think we need reliable global research on how the COVID-19 pandemic is spreading so rapidly like this. I mean, we can't even be around family or friends without someone becoming sick or worrying if we will become sick with this disease, with this virus. We need to find out what is making this virus spread like this, and we need to find this out like yesterday. And I don't think that schools should be pressured into opening back up, not now. Our children are vulnerable. Our children are too precious. Until this pandemic has a cure and we find out exactly what is making this pandemic the way it does, no child should be pressured, no parent should be pressured, no city school district should be pressured into opening back up or sending kids back into school. This deadly virus is here, and it doesn't look like it's going anywhere. We need strong leadership to make sure that everyone that is working on finding a solution to this virus is doing their jobs. We need to remove politics out of the equation and find a cure and stop gambling with people's lives.
You're listening to Let's Talk About It with your host, Aminah G.
Fall is nearing, and they still don't have a clue. They still don't have a solution. We are going to see more deaths, more people hospitalized if we don't get this virus under control. And the worst part of it all is it didn't have to be like this. If only they would have listened. Now it's too late. Unlike most strains of the flu, the spread of this virus has much higher death rates. The United States of America has imposed sweeping restrictions as well as leaving some quarantine measures in place. But other countries have also taken aggressive measures to counter the virus, in some instances more than the United States. The focus all over the world has to be on saving lives and preventing new infections. Science and medical researchers have for years deferred over the exact definition of pandemic. Is it a pandemic or an epidemic? One thing we can all agree on is that the word describes the widespread of disease. Until everybody in the country gets serious and take this virus serious, I'm afraid that this virus will be here for a very long time to come. Yes, It is unfortunate, but true. You are listening to Let's Talk About It. Make sure to tune in every Sunday morning at 9 a.m. where we will discuss any and every issue that are plaguing our communities. Until the next time, my people, take care, stay safe, wear your mask, and be kind to one another.
You have been listening to Let's Talk About It with your host, Aminah G.
Raw and uncut. Let's talk about it. It's the podcast show hosted by Aminah G, where we talk about anything and everything that's plaguing our black communities,
Including the killing of unarmed black men and women.
but we're not just reporting the news, we talking about the solutions too. So we gonna talk about it every Sunday at 9 a.m. Let's talk about it with Aminah G.